Okay, that's great. So, in today's session, we are going to discuss further uh, from the first block, and this would be mostly about the concept of HIV/AIDS. I hope that you all know a little bit about this. I'm sorry, there was some problem with the device. So I hope. Am I audible?
Yes, ma'am, you're audible.
Yeah, thanks. So, basically, I really hope that you all know a little bit about HIV/AIDS. Anybody who can give me a brief description about whatever they know about the disease. Anas, can you tell us something about it? Do you have any idea? Anybody? Okay. So, HIV/AIDS is basically it's no, you cannot say it's actually a disease. It is a system of it's a complex of symptoms. Now, HIV/AIDS is actually caused by a virus which is known as the human immune deficiency virus. Okay, and it is first of all, it was identified in humans in the year 1981 in United States, and since then it has been identified by and a lot of patients suffering from HIV/AIDS have been found across the countries, and several countries today are actually in the midst of a crisis with regard to the spread of HIV/AIDS. Today, it is considered to be an epidemic, like its spread is so vast across all sections of the society that it has been declared as an epidemic. This was specifically very much a problem during these decades of 80s, 90s, and 2000, 2010s. It was a very, very big concern among most of the countries, both developed as well as the developing countries. But over the period of time, United Nations, as well as its all the members of United Nations, they have targeted this disease to an extent that very extensive programs have been started by the governments all across the world, and basically they came up with several programs as well as ideas to manage this disease among population. And this was actually done by it was actually done after, you can say, after a thorough planning and strategizing about it. Okay. Now, what happens is human immunodeficiency virus is a virus which is responsible for causing this infection in humans. Now, this is actually known, it is a retrovirus. Retrovirus means that we generally have the DNA as a genetic material, okay, in our bodies. You know what is DNA? What is RNA? Anybody who can tell me? What is DNA? What is RNA? Hmm? Anybody who's having any idea about genetics at all? Okay, so basically, what happens is that the information, the genetic information, okay, that is what we call as the genes. They are transmitted from one generation to another through what we known as the DNA, that is the deoxyribonucleic acid. And there is another component which is known as a cellular component which is known as the RNA, that's a ribonucleic acid. In most of the animals, including humans, genetic information is transmitted through DNA. But in case of this retrovirus, this HIV, that's human immunodeficiency virus. This information is transmitted through what is known as the ribonucleic acid. Okay, now that is why it is a little bit different from the other other you can say microorganisms. Now, when we talk about this AIDS epidemic, I have already told you that this was first of all identified in 1981 in United States, and actually it wasn't identified as a kind of an infection. What happened is the person who was found infected suffered from some other very rare type of diseases, which was actually not affecting a large number of population. So it was a very rare disease that that person had been infected. And when his blood was taken and the tests were done on this, the doctors found this kind of a virus which infected that particular individual, and that uh, it was also found that the person had very low or suppressed immunity inside the body. Now, what is immunity? Immunity means that our body has a certain defense mechanism, which protects us from the microorganisms who are there to cause diseases in our body. Okay, so it is through this immune system of our body that we are able to do what? We are able to protect our body from microorganisms like bacteria and viruses, because what happens that these cells, which are part of the immune system, they protect the body from some foreign agents. So they are able to identify and they are able to fight against these microorganisms. Now, what happens when an HIV virus, when a human immune deficiency virus, it enters our body, it starts to attack these cells which are part of the immune system. And as a result, what happens that the body, these cells which are part of the immune system, they decrease in number, and as a result our body, it becomes susceptible to a lot of other infections, because our immune system is weakened very substantially. Okay, so it causes a lot of weakening of the immune system, and as a result persons who are suffering from AIDS, they contract some other diseases, and as a result of this, since their body become weak, they are not able to fight against these diseases. Now, AIDS, as we know, is it is known as its full forms. It stands for Acquired Immune Deficiency Syndrome. So, as the name suggests, it's actually a complex of symptoms. Okay, it is not a disease in itself, and the patients who are suffering from AIDS, they do not die of AIDS per se, but they die of the other opportunistic infections or other infections that inflict their bodies because of the weak immune system. And as a result, the medicines and anything which we administer to these patients, they don't actually work. Yeah, right, because the immune system of the body has weakened so much that our cells are not able to withstand the onslaught of such diseases, and they are very much susceptible to diseases like tuberculosis, certain types of cancers, several types of other transmitted diseases. And usually the patients suffering from AIDS, they die of these infections, which are called opportunistic infections or secondary infections. Okay. uh, Now, what happens? We have also studied about, yesterday, we also studied about the two types of diseases. One is known as a communicable disease, and the other known as a non communicable disease. So, if you remember, communicable diseases are those diseases that can be easily transferred from one person to another, right? And non communicable diseases are generally diseases which are chronic diseases, which are not transferred from one person to another. Like you have the heart disease, cancer, diabetes, cataract. These are non-communicable diseases. So a person who has actually these diseases, they are not going to infect the other persons. But communicable diseases can easily be transmitted from one person to another. And AIDS is a form of highly communicable disease. Okay, that is, it can pass on from one individual to another, but there are certain ways through which AIDS will uh, pass from one person to another. Okay, apart from those reasons, apart from those ways, usually AIDS is not transmitted, but there are certain reasons, or there are certain ways in which AIDS get transmitted from one infected person to other infected system. uh, Now, what happens is, I told you that in 1981 in US, there were some doctors who came across a quite unusual infection in a person who was homosexual. Now, what do you understand by homosexual? Anybody who can tell me what are homosexuals? Who are homosexuals? Anybody who can tell me who are homosexual? Ever heard of gay population or homosexuals?
Yes, yes.
Yes, yes, ma'am.
Yes, Anas. I'm so glad that you people finally
Ho-
responded. Yes. So who are gays? Who are homosexuals?
are the people that have sex through the button, not exactly from the vagina. They are the people that are doing homosexual, which have
No, no,
groups like gays and so on.
no, no, no.
Hello, hello.
Homosexuals.
Hello.
Yes, yes, Triple
Can
Zero.
I?
Yes,
Yes. Homosexual. There are people that have sex with the same sex gender. It's like male,
yes,
male, female, and female.
yes. Yes, exactly. Okay, got it. So, homosexual persons are those persons who establish a physical relationship or sexual relationship with the person of the same sex. So, if it is a male, he will prefer having a sexual relationship with a male, and if it is a female, she will prefer having a sexual relationship with other females. Okay, so they have a little bit of a different, you can say, sexual orientation. Now, when in 1981, the doctors, they saw this person who was homosexual. He was having a very unusual infection inside his body, and on top of that, he was not even responding to any other kind of medications. Okay, the person, of course, he could not live longer, and he very soon he died of out of that. When they studied the illness, it was a new kind of illness that had come up, that they could not recognize, and this was later on named as acquired immune deficiency syndrome. So if we break down the words, of this disease, we come across that as acquired means a person has got infection from somewhere. He is not, or she is not born with that disease. Acquired means to get it from somewhere. Okay. Immune means the body's defense system, the body's defense mechanism. Deficiency means that it is not working properly. Something deficient means it's lacking or not working properly. And syndrome means a group of signs and symptoms. So that is why I say that although I'm using the term disease, AIDS is not a disease, but it is rather a complex of signs and symptoms. Okay. Now, the word acquired was chosen because it is not genetically transmitted. So, a person is not born over it, with it. Okay, they generally acquire it during their normal period of life. Now, we know that we have studied what is HIV, and one thing about HIV is that it is a human immune deficiency virus, which is a retrovirus, which means that it has ribonucleic acid or RNA as its genetic material, and this virus generally requires a host in order to survive. So it cannot, survive anywhere. It can only survive inside the human beings, and it can be passed on from one person to another, but there are only limited ways where it can how it can be transmitted. So unlike a common cold or a flu, which is generally transmitted by air, uh, this virus is not contaminated through, it does not, it cannot, you cannot catch HIV through air. Okay. Now basically what happens is that this HIV virus was first described in 1983. So if you actually look at it, it looks like, a kind of a flower. It has that kind of appearance. And what happens that when it enters the body through various ways, there are 4 or 5 ways in which it enters the body. It starts destroying the T cells of the immune system. Now immune systems consider a number of cells. Okay, largely they are known as the lymphocytes, and in that there is one particular type of cell which is known as a T cell. This virus generally infect the T cells and it kills it. Okay, so it distorts this by sending its genetic material inside, and that is how the human immunodeficiency virus survives. Initially, this is generally non-symptomatic. A person will not know about this infection for some time. After that, it becomes symptomatic and they start showing some physical symptoms. Now, there are actually, if we can say, there are different phases or different stages of virus of this AIDS. The first stage is known as the initial infection or the window period. This is the stage where the virus enters the human body either through a breach in the mucous membrane during sexual activities or through contact of blood. Now, we will discuss the various modes of transmission later, but for now, we will just look at the different stages. So, the first stage is basically known as the initial infection or the window period. In this period, generally the virus is not, it cannot be identified, and if you carry out any tests during this period to check the presence of virus, it will come out to be negative. So during the initial period, the person who has contracted the virus, they do not show any kind of symptoms. Okay, and this is called as the window period. Why? Because the tests that we generally do to identify the presence of HIV inside a human being, they all come negative. Okay. The second stage of this infection is what is known as the seroconverting illness. Now, this is a period which comes around after a period of 2 to 6 weeks, where the patient may suffer from a mild fever. The patient, at this point of time, during this stage, the blood, it becomes positive. So if you administer tests on an individual during this period, then he or she will be tested positive. Okay. And this period lasts for around 2 to 3 days, and there is a sharp decline in the CD4 cells, that is the immune cells of the immune system, and from a normal of more than 1000 cells, they may drop to somewhere less than 500. And at this point of time, the person also may suffer from other kind of symptoms, like body pains, skin rashes, or sometimes even paralysis of nerves. After 3 to 4 days, the patient becomes normal, but the cells count, it does not come up to be at the normal levels. The third period of this infection is known as the asymptomatic phase. Okay. Now, the asymptomatic phase means that during this phase, the patient is totally asymptomatic. There are no symptoms or signs, but but the test that we administer, it comes positive, and the counts of the cells, okay, the immune system, the cells of the immune system, the cells, they decline over a period of time. This stage may last for around 5 to 10 years. Okay. It can be more than that, or it can be less than that, depending upon a lot of other things. And for patients, it differs from patients to patients. Basically, sometimes it may even last from 3 to 7 years. And during this phase, the body produces lots of antibodies, and the patient may suffer from several kinds of autoimmune diseases. Now, what are autoimmune diseases? Can anybody tell me? What are autoimmune diseases? Anybody who has any knowledge? Autoimmune diseases. What are autoimmune diseases? Autoimmune diseases means that the cells of the body, they start attacking their own cells. Okay, your cells in the immune system, they start attacking the cells of your own body. That is why it is known as the autoimmune diseases. Okay, there are a lot of immune diseases, which a person may suffer from, which are autoimmune. Like, there are certain kinds of bleeding disorders. It could also lead to some paralysis, muscular dystrophies, and so many other things which are actually related to autoimmune diseases. Okay, that is the cells, the cells of the immune system, they start attacking the cells of your own body. Okay, they start destroying the cells. That means that the working of your organs as well as your organ systems is very much declined. Okay, and it's kind of, your body is attacking itself. It's like that. The fourth stage in this is what is known as the intermediate phase. In this, the patient may become symptomatic once again, okay, and it may manifest as some minor skin infections or some other diseases. Then we have the stage of AIDS, which is when the patient is found with several opportunistic infections. That is the secondary infections which infect the body. Like I said, it could be some forms of skin disorders or cancers, or it could be even tuberculosis, which is very much common among the patients suffering from HIV/AIDS. And the last stage is what is known as the terminal stage, is when the number of cells in your immune system that count specifically the CD4 cells, the count comes to less than 50. The patient stops responding to any kind of therapies, and they have more and more serious infections. And this is basically the last stage, after which the patient may succumb to the disease. Okay. Now, one thing is that generally till now, there has been no cure for HIV/AIDS, but it is still seen that if the patient is given proper medications, if he follows a more disciplined life, and also good nutrition is given to the patient, then his or her life expectancy may improve considerably. So there are a lot of people who have been able to come out of this, not exactly fully recovered, but they are leading a more healthy life after making some major lifestyle changes, changes in their diet, changes in their nutritional intake, and as well as the taking up of medicines on a regular basis. Okay, so this is what is usually seen. Now, there is a very, very you can say that close relationship of patients suffering from HIV infection and they contracting diseases like tuberculosis and sexually transmitted diseases. Now, tuberculosis is actually an infection which is caused by a bacteria which is known as Mycobacterium tuberculosis. Although this bacterium is present in the body, it does not do any damage in healthy individuals. Okay, normally when we have a good immune system, this bacteria does not impact our body, but people with HIV, they suffer from tuberculosis because their immune system is depressed to a great extent. Okay, now, tuberculosis is an endemic, it can be easily contracted and from one person to another. And this is very much seen in countries which are developing, where there is a general high percentage of people living in poverty with inadequate health facilities, nutritional facilities, and places specifically which are overcrowded. For example, in slum areas, you will find that the conditions, they become quite ideal for this kind of disease to thrive. Okay, now in among the patients, as we have seen that specifically in several sub-Saharan African countries, okay, and countries in Southeast Asia, tuberculosis is one very big epidemic apart from HIV/AIDS. Okay, so you all know if this disease is existing in your country. Even in India, it is very much into existence, and a huge population is under its impact. Who all have any knowledge of tuberculosis in their country?
Yes, ma'am, we have that issue in Nigeria. There is even a hospital that is donated to the people suffering from
Yes, yes.
tuberculosis.
Yes, yes, definitely. And this in specifically some countries like Uganda, Zambia, Rwanda, and Mali, they have reported a quite many increase in the number of cases of tuberculosis since the 1980s. The period after that, they say that these countries have reported a high number of cases suffering from tuberculosis. Now, what happens is even in Southeast Asia, like in countries like Thailand, India, in Myanmar, in Nepal, you have a lot of people who are suffering from this tuberculosis and AIDS. Now, even in India, we find that this is a very common problem among people who are suffering from HIV, and majority of the patients who are suffering from HIV die because of infections and other complexities related to tuberculosis. Okay. Apart from this, there is another major concern which is known as the sexually transmitted diseases. Now, anybody who has any idea about what are STDs or sexually transmitted diseases? Change it. Anybody? What are sexually transmitted diseases?
Hello, ma, what do you say?
Yes, Anas, tell me.
Come again. I did not hear what you said.
I am saying anybody has any idea what are sexually transmitted diseases or STDs as we call them?
I think sexual transmission disease are diseases that are usually spread during sexual activities.
Yes, of course. So, what happens is yes, Candero, you want to say something?
Yes, Mother, I just want to repeat what Francis already said that STDs are infections that are primarily spread through sexual contact.
Yes, true.
Yes.
So, yeah, of course. So, sexually transmitted diseases, as the name suggests, These are diseases which are transmitted from one person to another during the unprotected sex. Okay, so whenever one partner is suffering from a sexually transmitted diseases, okay, some kind of diseases, this is likely to infect the other person also. So you have a number of such diseases like gonorrhea is there, chlamydia is there, okay, trichomoniasis. All these are actually diseases which are caused due to unprotected sexual activities, and they its impact can be from mild to very severe. And generally there are certain diseases which can be very very painful, and they can be very difficult to even treat at times. And there is a very you can say there is a strong relationship between HIV and STDs, okay? Because HIV also spreads through the similar manner as the sexually transmitted diseases. So, unprotected sex with a person who is suffering from HIV is likely to result in the other person contracting the HIV virus. And that is why, among the patients who are suffering from HIV, they are at a very high risk of suffering from these sexually transmitted diseases as well. Now, once we say that basically AIDS is different from other epidemic diseases, how can we say that AIDS is a disease but it's different from other epidemics? Okay. First of all, see, unlike other epidemic diseases, AIDS can be transmitted only through various limited conditions. Okay, it is not transmitted by touching or through air. That is not the mode of transmission. There are very few reasons or very few mode of transmission of HIV from one infected person to another infected person. Okay. Secondly, unlike other diseases, AIDS does not result in death of the individual. The individual die because of the other because of the other secondary infections or the other opportunistic infections that may be contracted by him or her because of the low ability of the body to protect itself, okay, because of low immune system. Now, how does the AIDS progresses? Generally, what, how does the AIDS progress, or what is the general, how does it takes to actually in how much time does it take to infect that person? It would depend upon the type of the virus, also depend upon the viral load, like how much viruses have been infected, have gone into the body, inside the body, and the general health of the patient. How is the general health of the patient? Is he or she suffering from some other disorders, or it's generally having a low immunity overall? So it is related to that. Generally high viral loads are associated with faster progression of AIDS. So once you contract this disease, there are different rates in which this disease will progress. So sometimes it is having a typical progression, which means that a person will get infected with HIV and he may survive for a period of 8 to 10 years without any therapy. Okay. The second is what is known as a rapid progression. Rapid progression is generally is the time where the patient succumb to the disease within a short span of 2 years, or maybe 2 to 3 years. Okay, this is generally seen when the disease takes place through the blood transfusion. So in this case, there is a very heavy viral load. Okay, so a larger number of viruses, they enter the body because of this. And the third is the slow progression. Generally a very small percentage of people, they have a slow progression of HIV, and generally in this, the patient may survive as long as 20 years. It depends upon other factors. Now, after this, we will talk about the various misconceptions that are related to HIV/AIDS. Now, first of all, HIV is there are a lot of misconceptions, that is there are a lot of wrong informations that is generally spread among the people related to HIV/AIDS. Most of this information is largely unscientific. There is no truth behind this, and many a times what happens that it leads to a great deal of discrimination uh, with the people who are suffering from HIV/AIDS. Okay. Now, the first belief is that AIDS is generally a someone else's disease. What do you mean by that, someone else's disease? Generally there is a feeling that it cannot contract us, like we cannot get contracted by HIV/AIDS at any point of time. Many people have this kind of a feeling that we cannot get AIDS at any point of time in our life, that we are totally immune to this disease. And this is the reason why lot of people they contract HIV/AIDS, because of the risk taking behavior that they show. Now, what is this risk taking behavior? We will see this later when we study the various mode of transmissions. Okay. Now, another HIV, another misconception related to HIV is that generally, if you shake hands with a person suffering from HIV, then you are likely to contract the disease. This again is totally baseless. You cannot contract disease through this as long as your skin is intact without any breaks or injuries. And so you have to have basically a flow of body fluid, okay? Transfer of blood or sexual fluids to happen if one has to contract AIDS. But if there is no contact of blood or sexual fluids during the shake of hands, and so there is no risk involved. Okay. So it is totally baseless that a handshake or a shaking hands with a person who is suffering from HIV/AIDS is likely to cause a disease. There is another misconception that maybe sharing a toilet or a bathroom with a person suffering from HIV may cause this disease. But again, the chances of getting infection by using the same toilet seat, they are very remote, because again you need to have a fresh infected blood on the toilet seat in contact with breaks in the skin, which is again very not very possible. And so proper and clean use of toilets can definitely prevent this kind of a situation, but usually the chances of getting infection through this mode are very slim. Sometimes people have this misconception that maybe sharing a toothbrush is going to maybe cause HIV. But again, saliva, it contains HIV virus in minute amounts, and it also contains an enzyme that inhibits the growth of the virus. And this small amount of saliva is highly unlikely to transmit the virus, and that is why it is generally seen that using a toothbrush is unlikely to infect a person. Then there is also a misconception, or there is actually questions about whether HIV is present in sweat. So usually very lot of tests have been carried out, but till now all of these extensive tests have failed to detect HIV in the sweat. Okay, so again, there is another misconception that maybe kissing or embracing a person with HIV is likely to cause. Okay, but again there is a thing that again you need to transmit some kind of a blood, okay, or sexual fluids. So usually when persons are kissing, if it is a dry kiss, then the chance is almost zero. But but if it is like like something like a French kiss, or maybe this a deep kiss, then it might be a possibility that there might be some kind of crack inside the lips, or some bleeding gums. And when we come across, and the other person is also having a similar problem, then although then this might happen, but the chances are quite slim. Then there is also a misconception if the contact sports are safe. Now, again, it is the same thing. You need to have two wounds rubbed against each other in order to infect a person. So, this is extremely unlikely, and therefore, contact sports are quite safe. Same thing with swimming pools or ponds. Even it is very highly unlikely that the persons are likely to get HIV infection if they use a swimming pool in the along with the person who is suffering from HIV/AIDS. Now, there is again a common question that comes is whether HIV can be transmitted during the case of rape. So yet is there is a possibility, of course, and the risk, it can be higher because violence can be used. This can make certain abrasions, and bleeding is more likely, creating multiple entry points for the viruses. So if one partner is infected, there are chances of infection in the other person as well. So of course, this is a possibility. There is another question that comes up, whether we can get HIV/AIDS by giving blood. So when we are giving blood, of course, generally the hospitals, they have a proper protocol on using needles, fresh needles, when they are taking blood. So definitely, it is a very remote chances that a person can get infected by giving blood. So that is, of course, as we say, that you need to have infected needles injected inside the body, but this does not happen in case of giving blood, because the hospitals, they have to follow these protocols very strictly. Okay. There is another question on whether we can get HIV by receiving bloods. So, yes, the chances of HIV transmission through infected blood is very high, and around 90 to 95% there is a high probability that transmission can happen through this route. Although about only 5% of the global infections are uh, uh, due to blood transfusions. And this also eliminated from the fact that usually, as I told you, that hospitals are supposed to follow certain protocols when it comes to use of blood and blood related products, use of syringes, and use of other instruments when they use on the patients. And usually whenever a person is giving blood, the blood is tested very thoroughly before it is injected into the blood stream of another patient, okay, who in need of the blood. So usually when this happens, then the chances are very less, but there are chances that this transfusion may lead to HIV infection if the hospitals or the other health care providers are not following the protocols thoroughly. Okay. Now, there is another question on whether the breast milk causes HIV. So, of course, a woman who is pregnant, she may pass the HIV from her body to the newborn baby, and this chances increases very much when the woman is breastfeeding. But there are about 14% chance of infected mothers transmitting the infection through breast milk. And but generally bodies like the World Health Organization and UNICEF, they advocate that breastfeeding, specifically in developing countries, uh, need to be done, because it's despite the chances of infections, because the chances of infections through the bottle feeding are much higher as compared to the breast milk. Okay, because a child may contract other infections if he or she is fed through the bottle feeding. This is largely because generally parents are not having much idea about sterilizing the bottles. So the person, the individual, the child may contract some other infections if the bottles are not cleaned properly, if they are not sterilized before the parents give milk to the baby. So that is why, and generally it is seen that the mother's milk is considered to be best, at least for the first 6 months of the birth of the child, birth of the after the birth of the child. But yes, there is of course concern that HIV infected mothers may pass this virus. Although nowadays, whenever the women who is HIV positive, they are generally given a great deal of counseling right from the first stage till the time that they have to lactate, till the time that they are lactating or they are breastfeeding the baby. So of course this is one possibility, but then there are a lot of you can say counseling that is done to mothers. How can you matlab, how can you stop this transmission to the child? Now again, some may think how safe it is to go to the dentist. So generally it is safe, and it also depends that we have to be more um, you can say that we have to be more informed and educated, and we have to make sure that whenever we are making a visit to the doctor, whether it's a dentist or it's some other general physician, we have to be very um, uptight about this thing that we will be if they are using any instrument, then we have to make sure that they first sterilize that instrument. And if they are using needles, we have to make sure that they use fresh needles in order to inject. Okay, so this is something that is also apart from the uh, apart from the responsibility of the doctor, it becomes our responsibility also that we have to make sure that these protocols are thoroughly followed by the medical practitioner. Okay, now again a question comes up is how high are doctors and nurses at risk? So of course, I have to say that the healthcare providers, they and this include medical staff, the paramedical staff, as well as the social workers who are working with HIV/AIDS. They are at high risk of acquiring the infection. Especially, they can get infected through the injuries that they obtain during the course of their work. Okay, like even for doctors, needle stick injuries, they are the commonest mode of infections, including the nurses and the paramedic staff. Laboratory technicians, they can also get infected from injuries sustained during the process of handling blood in the lab. Okay, and so practicing universal precautions can definitely go a long way. It is important that they use things like gloves. They also use things like something like a gown, which protects them from any kind of a body fluid which may they may be exposed to during the treatment. Now again, a question is whether mosquitoes can lead to HIV infection. So mosquitoes definitely do not transmit HIV, because the HIV virus, it cannot sustain inside the body of the mosquito. So once it is out of the body of a human being, it generally does not survive. It is a very fragile virus. So it does not, of course, survive inside the bodies of mosquitoes. So a mosquito bite definitely does not cause the this. Now, apart from this, there are so many other unscientific and false information which are generally there. For example, people often say that once you contract AIDS, your flesh will drop and fall off, which does not happen. It is definitely not like that. Then there is a certain information, which generally floats that if the government discovers that you have AIDS, you will be given a lethal injection and you will be killed. This is certainly not true. Also, thing like AIDS is a result of sex over indulgence, and you can't get it if you visit brothels occasionally. This is false. Visiting brothels can definitely may put you at a high risk of getting AIDS. Okay. Now, eating a donkey meat can cure AIDS. There are some people who think like that. This is definitely not true. Okay, AIDS is a result of bad deeds. So many people think that, okay, we've done maybe something wrong and that is why we have been inflicted with AIDS. That is definitely not that. And also there are so many other such kinds of misconceptions and so many kind of false beliefs that people have, but all these are false, and we need to take special attention in order to make ourselves educated about what causes AIDS, what does not cause AIDS, and how should be our attitude towards persons who are suffering from HIV/AIDS. Now, there is also a concern about whether tattoos and ear or nose piercing causes AIDS. Now, this is something which we see very often happening, that many of the people, especially persons among the tribal communities, you will find they go for a lot of tattoos and they go for ear and nose piercing. Like, for example, in India, ear piercing and nose piercing is something which is generally done on girls as well as boys, on young girls as boys. See, even I've got my ears pierced, if you can say. It is quite necessary actually in Indian families to go for ear and nose piercing, and lot many people nowadays are also going for tattoos. Now, this there is a risk involved, but it is quite negligible. Specifically because now people are becoming all the more educated, and they know that when you are getting these things like piercing and tattoos, you have to make sure that the needles that they are using, they have to be fresh needles. Okay. And once we sterilize the instruments, and once we are using a fresh needle, then the chances of spread of HIV/AIDS are almost zero. So viruses, they can be killed at high temperatures. Okay, so the simple method of sterilizing the instrument can actually easily kill the virus. Now, after this, we will discuss about the uh, misconceptions which are related to the care, treatment, and rehabilitation of these patients. First of all, there is often a misconception that it is necessary to quarantine HIV/AIDS patients. See, first of all, we need to empathize with people who have contracted HIV/AIDS, and instead of sending into quarantine or treating them in different hospitals, they need to be treated in general hospitals like any other patients in order to, um, prevent such kind of ostracization. And sometimes due to lack of awareness, in many cases we find that patients suffering from HIV/AIDS are refused treatments in general hospitals, and this becomes it becomes really difficult for such patients to get medical treatment. And since they are at times quite isolated by their families, by the general community, it becomes very difficult for them to recover from this disease because of the mental stress that they show. Okay, it forces a patient towards poor recovery because they are under high mental stress. Okay. Now, deinstitutionalization means the family is taking care of the AIDS patients. It helps the patients to recover quite faster. It is seen, that when patients are living with their families, when they're living with the communities, and where the people are quite empathetic towards them, then we will find that they are much they are able to cope with the disease in a better way. Now, as I have already told you that there is still no cure for HIV/AIDS till date. In many of the countries, the progression of this virus has been curtailed to some extent as a result of antiretroviral therapy. So, the therapy which is given to these patients who have contracted HIV is known as the antiretroviral therapy. It does reduce the incidence of opportunistic infections, and it can also increase the lifespan of infected individual. But there are a lot of side effects, related to this therapy. And another thing is that it does not cure the infection fully. Okay. At present, this therapy has been recommended, although it is very, very expensive. And for most of the populations who are devoid of resources, it is still something that they cannot afford it. So in this situation, the patients, they become, quite restless to somehow find life-saving drug for their illness. But but as of today, there is no known cure for HIV/AIDS. Although it is generally seen that when people, they take proper nutrition, when they take the proper medications that are given to them by the doctors, when they change their living lifestyle, then they a more disciplined lifestyle, then we see that their life is prolonged to quite an extent. Okay. Now, uh, in the next unit, we are going to talk about the history of HIV/AIDS, like how did this disease was recognized, how it was clinically described, what is the history of HIV/AIDS in the world, and what are the theories of origin of HIV/AIDS. Okay, so we will see this in this particular unit. Now, see, in the past, we have seen that there have been quite many epidemics that have been, impacted the world. Like you have cholera, plague. Now, these are epidemics which were quite frequent in several parts of the world. And at the turn of the 20th century, the world also faced an influenza pandemic. So if you I don't know if you know this, but generally during the period of 1980s to 20s, there was this known this influenza kind of this influenza kind of disease, which spread throughout the whole world, and this was similar to what we faced during the corona time. Okay. So there was this epidemic that we faced, which was during the early part of the 20th century. Uh, in 1981, we have already seen that the physicians who are working in Los Angeles, they came across a very serious illness among certain male population who were homosexuals, and these patients, they had a severe form of a rare pneumonia. Now, this is a kind of pneumonia which was very rare. It was identified as pneumocystic carni, and this is a very rare kind of an organism which is seen largely among the patients who have received chemotherapy for cancer. But there was no evidence of chemotherapy among these patients. It was Michael Gottlieb who first collected the 5 cases of these infections and published the paper in a very reputed scientific journal, where he talked about how this kind of an infection was seen. And at the same time, almost, a physician in New York, he saw a kind of a very rare type of a skin cancer which is known as a Kaposi's sarcoma. Before 1981, there were only around 500 cases of Kaposi sarcoma which were reported worldwide. But now there were quite many cases which were seen. And as a result of this, both these cases were reported in the journals. Now, what happened? These infections were seen among young males, who suffered from very severe defects in their immune system. So the doctors found out that all of these males, they suffered from very depressed immune systems, and as a result of this, another common thing which was between them is that all of them were homosexual or gays. Okay, and they had multiple sexual partners, so they had multiple sex partners. And they also uh, in 1983, okay, an elderly male patient was found to be suffering from what is known as the pneumocystic pneumonia. Okay, now he did not have any kind of a history of gay behavior, but he had been suffering from hemophilia. Hemophilia means blood cancer. Now, he had received quite multiple blood transfusions, and a similar case was also reported from another city in USA. Apart from this, in 1984, there were certain cases of children who were born to mothers who were abusing intravenous drugs. Okay, now intravenous drugs means that drugs are generally injected inside the skin of the individuals. So when they are taking up drugs as in when they are habitually they are taking up drugs. Okay, they're suffering from substance abuse or drug abuse, and they generally inject the drugs through intravenous, okay, using intravenous. So when they were injecting the drugs, they had somehow suffered from these severe immune deficiency, and the children which were born to such mothers, they had also inherited the same kind of a problem. By the end of 1984, a picture of how this disease was being spread, it became quite clear. And finally, by the end of 1983-84, this also this kind of a disease was also spread to other parts of this was also spread to other parts of the world, okay, in other groups. And finally, in USA, the Center for Disease Control, they named the disease as acquired immunodeficiency syndrome. Now, this caused a search for a cause. How is this disease transmitted? Till now, we had seen cases of, largely the gay population suffering from these diseases, but then we also found that there were some other cases also, like there were cases of individuals who had blood transfusion. There were cases of children who were born to mothers who were suffering from this kind of a depressed immunity. So there was a search for a cause of how this disease spreads from one person to another person. Okay. Now, Robert Gallo was an American scientist who had discovered a virus that produced a cancer in the human lymphocytes. Okay, and he named it the HTLV virus. This was also a retrovirus, that is, it used RNA as the major genetic um, transmitting um, 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 major agent for transmitting genetic information. Now, the tumors that were more common, uh, and this virus spread by blood transfusion and through sexual contact. And this postulated that the agent that caused AIDS might be kind of a mutant of that virus. Okay, and there were friends, physicians who were also seeing patients who manifested the disease that was similar to the disease seen among the Americans. So they had seen patients from some other countries who had kind of, seen similar symptoms as the patients from the Americas. Now, in 1984, finally, before that, in 1984, it was renamed, the HTLV virus was renamed as the human immunodeficiency virus. And this was found to be the cause for acquired immune deficiency syndrome. This was scientifically established, and it was thus named as HIV, which causes AIDS. Okay, so this is how the history of how this HIV AIDS was isolated, how it was named AIDS, and how it traveled from one country to another. And now we come to the history of AIDS or HIV in the world. Now, theoretically, it is possible for us to find out when and where the first case of HIV infection occurred, but in practice, it is not easy because the first case was found in United States, but it is definitely not possible to us for us to say that actually it is where it all started. However, we do know that HIV is transmitted mainly through sexual activities and through infected blood. So when we are using infected syringes, or when there is a blood transfusion taking place, and the third is from an infected mother to her baby during the birth. This is known as the prenatal transmission. And this is how the AIDS is transmitted from one person to another. Now, if we speak chronologically, then we find that the HIV origin of HIV, it can be traced from 1950s. So at the end of the World War II, there were only a handful of viruses which were known to cause diseases. And after that, many more were discovered, partly as a result of advanced techniques for culturing them in the laboratory. Now, virus, as we know, they are parasites which infect almost every form of life, like right from the single cell bacteria up to humans. Okay, so the viruses that infect bacteria, they are known as the bacteriophages or the bacteria eater. And then there are viruses which impact almost all organisms, including humans. The roughly simultaneous appearance of AIDS in United States, Europe, Africa, and Haiti, it prompted the question, had AIDS been around for some times unnoticed? So they were questioning whether AIDS has been around. So generally, after combining various medical histories of past patients, investigators, they found a small number of probable cases of AIDS going back around 80 years, okay, 30 years over three continents. I'm sorry. So basically, they found that the first patient of this disease could be found as early as 1959, who was suffering from AIDS like symptoms. Now, as we also know that at that point of time, people did not know it, but nevertheless, these uh, cases, they were reported, and there was a study that was carried out in order to find out the relationship between the cases which were found before 1950, in the 1950s, and then the cases which were found after 1980s. Okay. Uh, Now, one thing is basically what is generally done to combat AIDS across the world. What is being done? So we know that after the decade starting 1980s, the governments across the world, they became very concerned about the rising epidemic of AIDS, and various national governments, they started several programs in order to have a more holistic approach. Like they said that apart from preventing, we also need to provide proper management of this disease whenever patients are found to be HIV positive. So it has to be a combination of various preventive and curative measures. Okay. So for preventive measures, they suggested that first of all, we need to generally sensitize the population about how HIV is transmitted from one person to another, how we can stop the transmission of this virus, and what are the various habits that we need to inculcate in ourselves, what lifestyle changes we need to inculcate in ourselves in order to, we need to make in order to protect ourselves from this disease. Another one was the curative part. Now, since people have already been infected with HIV, what best can be done in order to prolong their life span? How can we delay the progression of this disease among the patients? So there were a lot of uh, discussions which took place in various bodies in United Nations, and as part of this, even in country like India, we had a national AIDS council, which is known as the NACO, which was set up by the government of India, and this was under the chairmanship of the prime minister, and they overseed or they supervised the uh, coordinated the programs which were started by the government in order to provide various preventive as well as the curative measures for the population throughout India. Now, I would really like to know if you know how the government in your particular country has uh, done for this HIV progression. Or are you aware of any such programs which is run by the national government in your country? Anybody who can tell me? Anybody who has any idea how, what the government in your country is doing?
Yes, in Malawi,
Yeah.
we've got macro,
Mm-hmm.
lighthouse where they combat HIV.
Okay. Anybody else? Ahmed, you are very quiet today. Are you there with us, Ahmed? Okay, yes. So, Ahmed, you have any idea what the government in your country is doing in order to combat this disease epidemic?
Hello, ma.
Yes, Anas.
Nigeria too, we have a hospital that was called Center for Transmission Disease Control. I know that hospital.
Okay, okay, okay. So, of course, one thing I would like you to do today is find out about the steps taken by the government in your country to combat HIV. Okay? Yeah, Michael, you can speak out loud. Oh, okay, you're not well. Okay, take care, Ahmed. No problem. We will be continuing the class in Monday, and I would really like every one of you to participate. And for the start, see, basically, the program is there, so you will have lot of information about what things are going on in India, but I would like you people to actually find out what is the respective national governments doing in your particular country to combat AIDS. Okay, what are the preventive as well as the curative measures and other measures that the government is taking in order to combat AIDS. Now, it's just not one hospital that is being set up. AIDS can be combated only after taking up several programs, having a you need to have a very you can say you need to make a proper strategy in order to combat. As I say that there are preventive as well as a curative strategy of managing HIV AIDS. It's like in India, we have a national body which is known as the National AIDS Control Organization or NACO, which is chaired by the Prime Minister of India. And this body looks into or it coordinates as well as it provides funds for the programs which are run across India in various states to combat AIDS. So not only they decide about having counseling, but they have also increased the scope of hospitals. They have started a lot many community outreach centers and programs. They have started counseling services. They have set up testing centers in almost all the district hospitals, which provide free testing for the persons, and there are also counseling counselors which are appointed in these hospitals. These provide the pre-test and the post-test counseling to persons with HIV/AIDS. Apart from that, how counseling of individuals from early age, like nowadays, you can say that on an average, people or children, they start indulging into sexual activities as early as 16, 17 years of age. So NACO was also overlooking how children in the schools as well as in other educational institutions, they need to be made aware of the of HIV/AIDS and how it is infected. They came up with a very you can say extensive protocol for the medical practitioners, for the paramedical staff as well as for the social workers. What are the various precautions that need to be taken, even for things like for the blood banks, okay, which provide blood to the patients in need of a blood transfusion. They are supposed to follow certain protocols which are very stringent, and the government is very strict about these things. Then they also focused on the social marketing of condoms and other such things, which helps to basically, at least we cannot say that it is fully responsive, it can fully protect an individual from HIV/AIDS, but it can do that to a great extent. So definitely these things they were in these things they were inbuilt into the program by NACO. Apart from this, there were also other centers that were started by the government, like the Indian Council of Medical Research, which were started in order to study the AIDS, bring up do some R&D, that is research and development, come up with some medicines or maybe a likely cure for the disease. Although now, till date, there is no cure, but still, as I said, that by following certain changes in the lifestyle and some diseases, we have been able to actually increase the lifespan of individuals who are suffering from HIV/AIDS. Now, in the next part of our class, we will be talking about the theories of the origin of the HIV/AIDS. Now, there are various theory of origins of HIV/AIDS as to how this disease came among the human beings, how it has started in the first place. So the first theory, so basically there are four theories which have been propounded. The first theory is known as the old human disease. They say that HIV has been around mankind for a very, very long period, and it's only recently it became more evident. So because of the increased development and improved medical techniques, the virus, we were able to isolate the virus, and that is how it came to be identified as an HIV, but otherwise it has been in the human population for a very long time now. Now, another theory, it states that it is kind of an animal disease which existed as part of the among animals, various animals, and because of the increased uh, contact of humans with such animals, this disease kind of crossed over to humans. Okay, so there was a kind of what we say, that the change that took place in the virus, and it actually crossed over from animals to the humans through prolonged contact with these animals. So this has been actually seen that quite many epidemics was actually it infected the animals, and then it spread to the other population, including humans. Like for example, even for the corona, which recently happened, do you know that they said that actually it is kind of a virus which exists in bat, and when people, they started working with bats, so they started eating bat meat, it was transmitted to, it entered the human population through that. And for example, there are so many diseases like malaria, and typhoid, which are transmitted through other organisms which act as the host organism for these microorganisms. um, Many believe that since AIDS is a sexually transmitted disease, it originated among monkeys. And some gave this idea that the original transmission from monkeys to humans, it took place through some sexual relationship. So this actually happened, and although see, it is just a theory, it is not necessary that it should be true, but it generally is considered to be a uh, chimpanzees, like for example, they are considered to be the most closest ancestor of humans. Okay, they are considered to be the most closest relatives of humans. And a virus is a very which is known as a simian immunodeficiency virus. It is found in monkeys, and this is very similar to the HIV virus. And that is why many people, they theorize that perhaps this virus, it came from animals, specifically the chimpanzees and other such monkeys. Now, then there was this another disease which said that HIV is a man-made virus which arose from probably from a germ warfare laboratory. Now, we also see that these things have happened, and at times we find that a lot of uh, such viruses and bacteria, they were actually being grown in the laboratory during the war times. And then it's kind of a biological warfare which triggers this kind of diseases among the humans. So it may have been into existence several years before 1980, when it started spreading across the various parts of the world. So this again is one say that it's actually a man-made virus, and it was uh, it started as kind of a biological warfare among the population. Another theory of AIDS is known as a mutation theory, which says that the origin of HIV AIDS is not of so much of importance, but most important is it is to understand where exactly HIV AIDS is going. Okay, now according to this theory, viruses are continuously being produced, and they are kindly, they are kind of changing, and they are mutating every now and then. We are getting new strains of these viruses, and as a result, we find that HIV virus is also probably a virus which kind of mutated, and then it entered the human population, and then it has been continuously being transmitted from one person to another, and this is how it is being promulgated to the into the human population. So these are the various theories of HIV that we see. Now, anybody has any other questions related to this particular thing? Anybody? Any question? Yeah, yeah, please, Emma, please tell me. You wanted to say something?
Uh,
Yes, Emma, say. Anas?
Hello, ma. I want to ask a question.
Yeah.
You said that we should go and find combats. is the federal government of our countries
Huh?
taking on HIV. Is that an assignment, or you just give us so that anyone can do it, so that by Monday we can present?
I'm sorry, Anas, I didn't get it. Uh,
I, you said that we should go and search or check for the combat that our government are taking on HIV. Are we
yes,
going to
yes.
Monday?
Yes, on Monday, I do expect that each and every one of you need to give me a presentation or at least tell me verbally what your respective national governments are doing in order to check this the transmission of HIV AIDS in your country. Like I told you about how things are being tackled in India, how the government has come up with the National AIDS Committee, and other such laboratories like ICMR, how they are doing some research and development on HIV AIDS. Okay, try to find a cure or maybe a way of tackling this disease. In a similar manner, I want you to give me a detailed information on what your national government is doing to check the transmission of AIDS, okay, in the population.
Okay, ma, thank you.
Yeah. Okay, thank you, Anas. Thank you so much. Now, after this, we come with the concept of HIV transmission and some of the issues that are there, some of the testing issues that are there with relate to the HIV testing. Now, we will be in this particular part of the presentation, we will be talking about the modes of transmission, that is various modes of how the HIV actually transmits from one person to another. What are the various factors that are responsible for causing infections, and how HIV transmission poses a risk in different practices. We will also study about the various vulnerable population, that is those population which are under high risk of HIV transmission. Okay. Now, I think we have already studied is that HIV is transmitted through sexual intercourse. Okay, it transmits through unsafe sex, and that is one of the largest known mode of transmission of sex, of transmission of this virus. Okay, from one person to another. So any person who is infected with HIV/AIDS can pass on the virus to another person who is not infected through this mode of transmission. Okay, and now what happens is persons most transmission, they occur from patients who are without any symptoms of AIDS. So generally what happens that these individuals, they may have contracted HIV. Okay, but usually what happens is they are generally asymptomatic. They do not know that they are suffering from AIDS, and this is how they are transmitting this disease from one person to another. Okay, now also HIV, as we know that it is present in all the body fluids, it is present in the tissues and organs, and like there is the blood, there is a genital secretions, for example the semen in males, the cervical and the vaginal fluids. It is also present in tears, in breast milk. The HIV, however, can pass on to individuals through three routes. So first is what is known as a sexual exposures. Second is contact with HIV/AIDS contaminated blood and blood products. And the third is from mother to child through pregnancy or childbirth. So these three are the major routes of transmission of HIV/AIDS in humans. First, we come up to the first we will look at the modes of transmission through sexual activities. Now, sexual activity, whether it is homosexual or it is heterosexual, it is the major route of transmission of HIV throughout the world. Majority of the cases that are found infected are because of practice of unsafe sexual activities. Okay. Now, generally, what happens? This virus can be transmitted by any penetrative or sexual act in which HIV infected semen or vaginal or cervical secretions or blood is introduced into the body through a break in the mucosa. Okay. Now, mucosa is the lining of the skin, internal lining of the organs. Okay. That is known as a mucosa. So there is, if there is a break in this mucosa, this blood or other fluids, body fluids which are carrying HIV can easily be transmitted into the bloodstream, and this is how a person can contract HIV/AIDS. So the sexual activities where this type of transmission occurs, they include, first is the penetrative penile vaginal intercourse. Okay. Second is the penile anal intercourse. And third is the oral genital contact. So these are the three ways in which sexual activities lead to transmission of AIDS from one person to another. Okay. Now, penetrative penile vaginal intercourse is the most common form of sexual activities where the penis of the male, it penetrates the vagina of the female, and this is where the semen passes into the vagina and into the body of the female. This is seen in heterosexual relationships, and this is a very common means of transmission. Another is a penile anal activity. This means penetration of penis into the anus. Okay. Now, this takes place in heterosexual as well as the homosexual partners. And generally, what happens is sometimes it is there is a break in the rectum lining, which makes it easier for the HIV to enter into the lymphatic system or the lymph system or the circulatory system of the individual. So this becomes a very common cause of disease, transmission of this disease, specifically from male to male transmission, which takes place through anal intercourse. Okay. Now, apart from this, there is also an oral genital contact. This means contact between the mouth and the genitals. This means that the oral genital sex is as considered as a route of transmission of HIV. Now, this is generally because individuals who engage in oral activities, oral sex, they rarely do the exclusion of other forms of sexual contact. Okay. Now, it is difficult to actually attribute transmission of HIV to oral sex and not to other type of sexual exposures, but generally it is considered to be one known source of oral of transmitting HIV from one person to another a person. Okay. uh, Now, generally, what happens in several countries, oral sex is considered to be very rare amongst people. For example, when studies were done in India, it was found that in the Indian subcontinent, this is rare among population because of lack of adequate privacy. Generally, there are large families, there are joint families living in, small houses. At times they do not have proper privacy. The couples, they lack any kind of adequate privacy, and that is why it is difficult for them to get into any kind of intimate sexual activities, so that is quite limited. Almost half of the population, again in the urban areas, they're living in slums. And now the houses in the slums are very small, and generally houses, these slum houses, they house more than, a large number of family members. And that is why that means that this privacy again is not provided to the um, couples. uh, so in many such countries, in many traditional countries also like India, usually husband and wife, they hardly talk to each other about sex and sexuality. So you will find that generally in traditional countries, this topic of sex and sexuality is generally not openly discussed in the families. So generally neither the parents, they discuss it with their children, nor the husband wife, they discuss it with each other. And that is why, these there are activities like oral sex are not considered to be the major mode of transmission. However, the number of studies are quite limited. So till now, there is no proof as to actually know that it actually leads to the mode of transmission or it does not lead to the mode of transmission. But generally, since it is part of the sexual activity, it is considered to be one of the mode of transmission. Now, factors which are responsible for causing infections. Now, there are some of the risk of becoming infected with HIV as a result of sexual activities is they include, first of all, the whether the sexual partner is infected. Okay. The second is the type of sexual contact that is involved and the amount of virus that is present in the blood or secretions of the infected partner. So, and finally, the last is the presence of either partner um, with other sexually transmitted diseases or genital lesions. So, all these are some of the risks which increase the risk of becoming infected with HIV. So, if the person, if the other partner is infected with HIV, and the type of sexual contact is penetrative, and if the amount of virus present inside the blood or the secretions of the infected partner is more, and if there is some other sexually transmitted diseases which is already there in in one partner, it is likely to increase the probability of getting infected with HIV. Okay, any questions till now? Any questions related to this? Now the yes, Candy. Okay, thank you, Candy Roo. So there are no questions as of now. Now, the prevalence of HIV infection among sexually active people, it varies in different areas and among population uh, belonging to different subgroups in those areas. Okay, the probability that a person has acquired a sexually transmitted HIV infection in general is proportional to the number of sexual partners the person has had in recent years. So we see that persons who are having multiple sexual partners, they are more likely to get infected with HIV AIDS than persons who are restricting their sexual intercourse with a single partner. Okay, so there are very rare chance that that person would infect the other person with an HIV AIDS virus, HIV AIDS. Why? Because first of all, if the individual is not having multiple partners for sexual purpose, it is very highly unlikely that that person will be infected with HIV until unless he has been given a blood transfusion, okay, from a person who was infected with HIV. So definitely probability of a partner having multiple sex partners getting HIV infection is definitely much more. Now, the type of sexual contact that is involved, that is also very important in this. Okay, for example, as we've already seen that all forms of sexual activity with any type of where any type of contact with body fluid is involved, that carries a high risk of HIV transmission. Now, there are certain activities that we have already discussed in the previous chapter, and where some basic misconceptions about viruses was about HIV/AIDS infection was seen. Now, one important aspect is the presence of uh, this virus among the commercial sex workers. Now, it is always very risky to take the services of commercial sex workers, okay? And we find that since because of the fact that they are having multiple sexual partners, so if an individual takes the services of commercial sex workers, then he or she becomes highly susceptible to the transmission of HIV/AIDS. Okay, so these are some of the factors that would affect the transmission. Now, then there are certain HIV transmission risks for different practices. Okay. Now we will see what are these practices. Now then there are certain unsafe practices with high risk of HIV transmission. The first is having numerous sex partners. We have already discussed that a person having multiple sex partners is more prone to contracting HIV. Second, having unprotected anal receptive sex with an infected partner. So that is why governments are providing free condoms to individuals. This is important not only for family planning, but condoms are also important to protect individuals from sexually transmitted diseases and from HIV/AIDS. Also, one thing needs to be understood that condoms are not a foolproof method of stopping the transmission. Okay, there are so many cases where the condom has burst inside, and this makes the partner very much susceptible to getting the body fluid from the infected partner. But, anyways, condoms are still considered to be quite effective, although they are not a foolproof method of safety. Now, unprotected anal penetration, that is also considered to be an unsafe practice. Vaginal intercourse without a condom, that is also considered to be an unsafe practice. There are some other practices also that are where the person is very much susceptible. For example, but there are certain low risk factors also which are related to this. For example, abstention from sexual contact, having a monogamous relationship, that is having a single partner, self masturbation by individuals, okay, dry kissing or touching, massaging, hugging, or stroking. All these activities, they are considered to be no risk of HIV transmission. That is why whenever there are individuals who are having partners with HIV, they are generally counseled to go for these various methods instead of going for a penetrative sexual intercourse. Okay. Uh, Now we come to the next section, that is the vulnerable population. Now, who are the vulnerable population? When we talk about vulnerable population, who are the vulnerable population? Vulnerable population means those groups of individuals who are at a high risk of getting infected with HIV/AIDS. Okay. For example, the first vulnerable population in this is the sex workers or the prostitutes. Now, HIV virus, as we know, that is primarily transmitted through from one person to another through sexual activities. There are various categories of persons who are vulnerable to HIV infection through sexual contacts. In every culture and society, we find that there are sex workers. They are mostly women, but nowadays we find that men have also started involving into male prostitution. Now, there are various types of sex workers that we will find. One is what is known as the organized sex work. you will find that in various big cities and towns, there are certain areas which are known as the red light areas or the red light districts. Does anyone know about the existence of these areas? You have heard about this? What are red light areas or red light districts? Anybody?
Red light areas are areas which are highly affected with HIV or AIDS.
No. Actually, red light areas or red light districts are, yes, Yami? Yes, Yami?
All right. To me, I feel like the red light areas or districts. I think we are talking of the areas that are actually highly populated, and they have a number of we can say like towns, areas that have a number of we can say what like there are things that actually happen like some promiscuous behaviors like the we're talking of even the thugs are there. We're talking of the prostitutes, like those the urban areas. I think I just think in that way. Yeah.
Yes, thank you, Yami. You said it. Yes, Anas, you want to say something?
Red light areas are areas where prostitution lives in group. In such areas, that are the areas that are called red light areas.
Yes, Anas, thank you so much. Thank you, Yami and Anas. You put it rightly. Red light areas. Yes, Anas, you want to say something again? Can
Yeah, these red rice areas, like areas where prostitutions and related activities are prevalent.
Yes, yes, right, right. So these,
Sure.
yes, right, Candero, that is true. So all of you are very correct. Red light areas or red light districts are actually places where prostituted individuals live in groups. Okay. Now these areas, these commercial sex workers, they live in what is known as the brothels. So you have the brothel where they will house a number of individuals who are into commercial sex work, okay? And they generally offer their services to the clients in these brothels. So they are kind of houses which house these sex workers, okay? Now mostly these are women, but apart from this we also know that nowadays increasingly men are also getting into prostitution. So the red light areas actually harbor these individuals who are into commercial sex work. Now, the second category of commercial sex workers is known as the call girls. Now, call girls are those who live in a more a comfortable kind of life, and they usually provide the services to customers in their homes or hotels. Okay, and these are known as the call girls. A third kind of practice is practice among certain tribal communities who practice practice prostitution as a means of livelihood. There are a number of tribes living in India who are actually into community prostitution. So the women and the girls of these communities, like you have the Bedias and the Gadias, and there are some other communities like the Kanzars and the Bhils. In these communities, in several states, they generally stay along the highways, and the women and girls, they are involved into prostitution, which is practiced as a means of livelihood. Then there is another thing which is known as the which is through religious traditions. In India itself, you have another group of young girls who are known as the Devdasis. Now, these are generally young girls, usually belonging to the poor families, who are offered to the temples. So they are actually dancing girls who are sexually exploited, and these are the ones who become sex workers later in their life. So this way you will find that there are so many different ways of getting into commercial sex business. And although in many countries commercial sex business is generally prohibited, there are a number of countries, like several countries in Europe, including Netherlands, where this is considered to be a profession. Do you know that in certain countries, prostitution is considered to be a profession, and that the prostituted women, they are actually taxed by the government. Okay, it is considered to be a profession, and they have to pay certain amount of professional tax to the government. So this is there. And because of these things, because of the multiple partners that they have to satisfy, these groups are very much, you can say, prone to contracting. They are very much prone to contracting HIV/AIDS. Anas, you have your hands up. Are you, do you want to say something? Okay. Now, the second group of population which are very much prone to HIV/AIDS is those in a same-sex relationships, or the homosexuals. Now, same-sex relationships are very high-risk activities. In fact, the first case of HIV, as we have already seen, is was discovered first in 1981 in USA, and excuse me, this was found among people who were involved in the same sex relationships. Now, this trend continued in various parts of the world until recently. We also see that very often individuals, they indulge into oral penetrative sex as well as the anal penetrative sex, which are considered to be high risk activities. And many a times these also are multiple partner activities. Many of these men and women, they get into the multiple partners, having sex with multiple partners, and in this way they get into all these they become very much prone to these relationships. Okay, now same sex relationships are very much commonly found in, you know, places like massage parlors. They are found in hostels where people of the same sex, they live. Like, you have women hostels, you have men hostels. So very often you find people indulging into sexual activities who live together. Prisons are very common grounds of such activities. Welfare institutions who taking care of the clients belonging to the same sex, like, you know, women hostels, juvenile homes, orphanages, they become a very common breeding ground for such activities. Then, at times, even camps of the armed forces, that is also a very common ground for this. Because what happens that soldiers, they have to live without their families, or, you know, for a long period of time with each other, and very often we see that they get into such activities. It is very much found among the street children, like those children who are living on the street. It is very commonly found among the street children. They are also found among laborers who are kept in camps. Okay, so very often we come across such camps which house laborers, and these laborers at time, they often indulge in same-sex activities. Another population which is very much involved, very much highly prone to such activities, are the eunuchs. Now, what are eunuchs? Who are the eunuchs? We also refer them as the third gender, okay? Because they do not identify themselves as a male or a female. We call them as a third gender. Now, usually what happens that eunuchs, they very commonly, they get involved into flesh trade. Okay, and that is why they are considered to be a very high risk group who are at a high risk of contracting HIV. Another common documented population who are at high risk are cases of sperm donors. Now, people who donate the sperm, they can also pass on HIV if they are infected. Okay, so these people there are several sperm banks which are located in various parts of countries across the world nowadays, and the usual donor of the sperm in the country, usually they are either poor laborers or they are street vendors. Many a times they can also be the drug addicts who donate their sperms for a price to buy drugs. Okay, so many of these professional these people, they also transmit HIV to other persons. So that's also very. Another studies was done on a high risk group, and it was found that many times individuals who are involved into transportations, okay, like the truck drivers and such other persons who have to stay out of their house for a very long periods of time, they were found to be a high risk group. Why? Because many a times they tend to take the services of the commercial sex workers. They also get involved into homosexual activities, and that is why they also are considered to be a high risk group for contracting HIV AIDS. Okay, so this is all about transmission of AIDS through sexual activities. What are the various high risk groups who are involved into who are in the who are at high risk of transmitting HIV AIDS or getting infected by HIV AIDS. So this is all for this session. Are there any questions from you? Anything that I need to clarify? Anything that I need to clarify? Okay. Now, since there are no questions from your side, I assume that you have been able to understand most of the things that were taught to you today in today's session. Now, we will meet again on Monday. And on Monday, firstly, I would like you all to get me information regarding the steps taken by the national government in your country to stop the menace of to stop the epidemic of HIV AIDS. And then we will start with the rest with the further topics in our presentation. And so I really hope that we will be having a good amount of interaction on Monday, where you will be presenting your whatever you have gathered, and we will continue with our discussion on Monday. So till then, I think we can call it a day, and I wish you all a great weekend, and I'm looking forward to our session on Monday. Okay, till then, I think take care. Yeah, and we can end the meeting, right? So take care, all of you, and see you all again soon.
Thank you, ma'am. Have a nice day.
Yeah, thank you so much. Thank you, all of you. Bye.
So I might be online, please, very soon.